4 things to remember about intestinal torsion and hemorrhagic bowel syndrome. They are both sporadic, which means that they affect individual pigs instead of affecting an entire group. They are non-infectious, and pigs that have clinical signs are between 4 and 6 months of age, so roughly growing to finishing pigs. They usually cause sudden death, so there are very little clinical signs that can be seen. They're good, healthy looking pigs, really nicely grown, that suddenly die in the group. And when you open the pigs at necropsy, you're going to see intestines that are filled with blood, but also that are really bloated. So they're pretty difficult to open at necropsy because their abdomen is so distended and makes it a little bit complicated for the veterinarian. So how do you make a diagnosis for intestinal torsion? Well, it's pretty simple. You look at the small intestine and the large intestine when you open up the pig. When you open the pig, usually the small intestine is on your left-hand side and the large intestine is on your right-hand side. A torsion usually rotates the intestine in a counterclockwise position, meaning that either the small intestine are on the top, cranially, towards the head of the pig, or all the way towards the right. And when you open the pig, you can find this torsion. To make a diagnosis for hemorrhagic bowel syndrome, well, you have to eliminate all of the other causes of hemorrhagic content in the intestine. So in your differential, you will have gastric ulcers, ileitis in the acute hemorrhagic form, or even swine dysentery. If none of those 3 are the cause of blood in the intestine, that means it was hemorrhagic bowel syndrome. So the etiology of those 2 diseases is pretty much unknown, but we have risk factors that have been identified. In the case of intestinal torsion, when the pigs run more, exercise more, especially after a meal when their gut is full, they are more likely to have this intestinal torsion happening. Especially growing pigs, when the first cut is sent to market, meaning that the largest, biggest pig are sent to market, then the pen is a little bit more empty, and the pigs that are staying behind have more room to run around and play together. That's when we can see an increase in intestinal torsions. For hemorrhagic bowel syndrome, the risk factors are a whey-rich diet or liquid feeding. So if you have an increase in cases of HBS, it's interesting to go back and talk with your nutritionist and see maybe how we can improve things. Thank you.